Hi, I'm Marianne Borer with HIMSS, and welcome to today's webinar. Thank you for taking time to be here today. We have an exciting program for you, but before we get started, I do want to highlight a few things so that you'll know how you can participate in today's event. All the engagement tools on your screen are resizable and movable, so feel free to move them around to get the most out of your desktop space. If you should need technical support during today's event, you can type your questions in the Q&A box in your media player. You can use that same box to submit questions for our speakers at any time. And if we don't get to your question today, we'll follow up with you offline. Engage with today's content and let us know how you're feeling with the emoji reactions. Now, if you miss anything, don't worry. You'll receive an email within 24 hours with a link to the on-demand recording when it becomes available. So now, let's start today's program. InterSystems automates bi-directional data exchange between Epic Payer Platform and Health Plan Workflows, sponsored by InterSystems. We're joined today by Stephen Burko, Head of Value-Based Market Strategy, InterSystems, and Kim Humby, Senior Manager, Product Development at InterSystems. Welcome, both of you.
Thanks, Marianne, and I want to thank everybody on the line for making time to learn about how InterSystems is automating bidirectional data exchange between Epic Payer Platform and health plan workflows. And I trust that everyone listening in already agrees that achieving that open flow of information is absolutely critical to advancing healthcare's quadruple aim. On the next slide, you can see that the National Academy of Medicine made this very point back in 2018. For those of you unfamiliar with this group, this is the outfit that published the highly acclaimed Crossing the Quality Chasm in 2001. And this is their report on interoperability. And on the right is a quote from the preface. Our healthcare delivery system requires unprecedented access to health information in order to effectively and efficiently provide the best care to individual patients and entire populations. But dropping down to the bottom line, true interoperability remains an elusive goal. Now, obviously, we've made a good bit of progress on interoperability in the last 20 years, particularly with respect to the exchange of information among providers and the back and forth with regard to administering claims. But scaling connectivity between clinical and quality data in provider EHRs and related information and analytics in plan operational systems remains a challenge for most. To illustrate my point, consider the graphic on the screen. On the far left, there are a large number of providers who would like to see more information about their patients within their EHR. Information about encounters with other providers, SDOH data, and so on and so forth. And over on the right, a lot of this information is actually sitting in plan operational systems. Moreover, there's a lot of insights that come out of these systems that plan leaders would like to actually be able to push into the provider's natural workflow to expose at the point of care to help with closing gaps, both care gaps and closing gaps. And the challenge is doing this at scale. We've already experienced a lot of success in creating one-off or point-to-point connections between an individual plan and an individual provider. But what we need to achieve is what I call multi-point connectivity, because there are just so many plans and even more providers. Now, for plans that have a sizable number of providers within their networks who are on Epic EHRs, this is where Epic Payer Platform can be very, very helpful, because it can enable that plan to connect to one point or hub, effectively Epic Payer Platform, which in turn reaches all the providers who are on Epic. But moving right, you can still see that we have a gap. And that's the ability of that plan to pull information out of Epic Payer Platform and transform it into diverse and varied standards that their own backend systems speak, and then vice versa, push information into Epic Payer Platform in accordance with the specs that one must meet for Epic Payer Platform to be able to ingest that information and then in turn expose it to their providers at the point of care. And going to the next slide, this is really the gap that Payer Connector was designed to bridge. And on the next slide, I actually try to give you a sense of what's going on at a very, very high level to facilitate this bidirectional data flow. So 4 things going on here. First, Payer Connector is simplifying the approach to complex integrations. How? By just using repeatable code. The fact that we serve so many people, we figured it out, so we want everyone to benefit from that economy of intellect. Second, by addressing legacy and incompatible formatting based on our deep knowledge of Epic specifications and our longstanding experience in enabling plans to actually route the right information to their different backend systems and transform it into standards that those systems speak. And together, this should enable both payers and providers to focus on those areas that really need kind of bespoke coding, really one-off treatment, and bottom line, altogether enable the bidirectional flow of data. Now, obviously, there's a lot more going on under the hood here. So let me go ahead and pull in my colleague, Kim, who actually oversees all the development of InterSystems Payer Connector.
Thank you, Stephen. So I think Stephen did a great job of sort of introducing the issue and why we felt there was something important we could build to help your organization as a health plan really make use of the great data that Epic Payer Platform queues up and makes available to you. So I want to take a step back for a second and just talk about this data problem in general. InterSystems has been in this space for a few decades now, and so we understand this pretty well. So I want to sort of talk about some of the challenges we typically see, and then how we think this complementary product that we've created can help facilitate within your environment. So in general, with healthcare data, the first issue is the data is really fragmented. Epic Payer Platform does a great job of easing the burden of that by pulling the data in directly from all of the Epic provider systems in your area that you've contracted with and making it available in Epic Payer Platform. They do so in healthcare standards and some Epic formats, and they make it available there. But we know that the people who work in your health plan typically are working within their operational systems, whether your care management system, your quality system, your claim system. And so what our product is very, born to do is help you take all that different data, regardless of the format, and get it into your systems, which also will speak a very different format typically. And so regardless of if the data that comes in through Epic, you can get clinical documents that are very, very large for one of your members. We can help you take out the pieces from that in the healthcare data format or the Epic specific schema and move just the pieces that are needed to your care management system, to your notification systems, to your system. And that's really the primary reason that Epic or InterSystems Payer Connector was designed. So let me take you even a little further down in terms of how we leverage this to do the right things for the typical use cases that we see. So within the heart of our platform, and again, as I mentioned, we've been in the business of healthcare interoperability for a few decades. I personally have been in it for a few decades, and InterSystems even longer. And so at the heart of what we've built in our healthcare integration platform is one, a standards-based environment that really truly speaks the variety of healthcare standards that have been, very present on the provider side for many years, from HL7 to CDA and CCDA, a little X12 when needed, FHIR, DICOM, and of course all the other healthcare standards that are coming out as we go forward. But on top of that, we have a very scalable system that is highly available, has built-in disaster recovery, all the right security and monitoring things you would expect for a robust system that has been heavily used throughout the largest healthcare systems in the United States and the largest healthcare environments in the world. And on top of that, we have key interoperability features that are at the heart of why we think this product is valuable for your types of organizations. Some of those include really simple adapters that help you connect and pull data out. In the case of InterSystems Payer Connector, those adapters specifically support the Epic APIs and the Epic formats to get data out of or into Epic, because of course it's really important to be bi-directional. It's not just about taking the great clinical data that Epic provides and putting it into your systems. It's also about getting the key data from your systems, like your gap in care, your measure report, and all of that, and moving it back to Epic Payer Platform to get it all the way back to the providers. We have a series of features around the routing and transformation of that data. For example, when you want to take, let's say, an admission notification from Epic, and you want to get that data to both your care management system and one of your other systems, so there can be some follow-up and some transparency and knowledge around what that member has been experiencing. You want to route it to multiple systems, but you also want to be able to transform it into the right format for each of those systems. And I'm going to guess that in most cases, that's probably a different format because you have different systems for that, right? And so that is the core of sort of the features and the interoperability that is built right into our platform, including some visual transformation tools, visual business process workflowing, visual business rules, and all of that is really easy to work with and build out of the box. So let me dig just a little further and show you a few examples before we begin to talk about the real use cases where you can get some true value here. So this is an example of our data transformation tool, where you can see we've got some clinical data components on the left and right here. But what's important to know is this is a standard tool that's been part of our framework within the InterSystems platform for many years and allows visual drag and drop between healthcare formats, and we have those formats built right in a visual way and ready to go out of the box. So for your environment, you can make any customizations and changes to get that into the exact format that you need with the right codes and the right style, so that it can then get moved right into your clinical systems, or sorry, right into your health plan systems, or the opposite, bringing it right back out. We also have our business orchestration layer, where you can build visual processes for more complex solutions. So in a lot of cases, you'll want to just simply take some data from Epic Payer Platform, transform it, and get it to your system where your care managers and your team is doing their work. In other cases, you'll want to take some data out of your systems and get it to Epic Payer Platform. But in some cases, you need to pull things from a couple places and do some massaging, do some logic before you know where to send it or how to act on that data. So we have a visual business orchestration layer built right in that allows you to do this. And as part of what that AppNight takes care of, you figure out your business rules and your business process, and the system automatically handles the rest. Like, it can combine synchronous and asynchronous workflows. It handles the parallel processing and resource management. It really makes it easy for you to think about what your business needs to accomplish, and the technology sort of takes care of the rest of it. And the other component that I think is really important to highlight is, because we've been in this interoperability space for so long, we know that one of the key things isn't about just building it, but also having the auditability and the traceability to know what happened, to identify where the data came from, where the data went, where there could have been issues if anything arises, and to really just have that full trace. And so our solution comes with, amazing logging and tracing things, including our visual tracing that lets you look at all the data, look at the transforms, and see everything going, from when it first comes into the system all the way until it leaves the system. So it's very robust, since it's used at, hundreds of healthcare environments around the world to do this work, as well as health plans. And there's a very robust set of transformation and interoperability tools built in. So going back to what Stephen showed you a few minutes ago, all of what I just said is sort of the technical, stuff underneath that facilitates this, but really all that is built in to allow you to then use this InterSystems Payer Connector between your Epic Payer Platform and your full ecosystem within the health plan, and do truly whatever is needed to support the delivery of member roster data, to support the delivery of ADTs or clinical notifications to the right systems, and vice versa with that bi-directional connectivity. So now that I've bored you with all the technical details, I did introduce myself as being from product development. So I don't apologize for getting into how it really works, but let's take it back up a level and help you sort of hear what value this can provide and what some real use cases are. So I'll cover a couple, and then Stephen, I'll probably pass it back to you, since I feel like people are probably hearing enough of me already. So let me just cover the first two, and then I'll pass it over. So we'll cover about 6 use cases with a couple variations. But let me talk about, firstly, member roster management. So for those of you who are using Epic Payer Platform, of course, the very first thing you need to do is get your active member roster loaded into Epic Payer Platform so it knows which members' data you care about, which members' data it should be facilitating, pulling from the various Epic providers in your environment that you're contracted with. So we've built this right in within our InterSystems Payer Connector. We support the Epic format and the Epic schema for what the data needs to look like for the member roster load. And we have the adapter built in to help facilitate you getting that data out of whatever the appropriate system in your environment is, whether that's your MDM system, whatever other system you have where you maintain your active member roster. We have the ability to pull that data right out of there and insert it right into Epic Payer Platform at the right cadence, whether that's weekly or monthly. And we have a variety of options for that to automate that process to ensure you always have the most up-to-date member roster within the platform. And it's important that this happens securely. It minimizes the administrative friction. You don't need to have anyone manually do this work. And of course, it supports the cleaner transition of data between everything if you're getting the right member records coming in. And you're getting, whenever you have new members added, those are automatically then going to end up in Epic Payer Platform very quickly so that you'll get the data on your newly added members as well. And once you start having that built right in, then the next thing you do is you can start taking advantage of the real workflows from Epic Payer Platform. The first one we see a lot of health plans right out of the gate want to start working with is the clinical notifications or ADT notifications. So this really gives you immediate information when one of your members seeks care for an ED visit or an inpatient visit or is discharged from an inpatient stay. These notifications can go into Epic Payer Platform. Then we can immediately facilitate getting those into your downstream systems. So that means we can extract the relevant clinical details. We can, such as the diagnoses, we can make available the information about that inpatient or ED visit so that you will know then how you can ensure you have the right follow-up care and facilitate helping that member, into the next steps. As everyone knows, there's a lot of value in having, direct real-time access to this ADT. Whenever one of your members seeks this acute care or is discharged from this kind of acute care or is released from an emergency room visit, knowing that, so you can properly support your member, knowing that they will need specific follow-up care and that you want to ensure they get timely follow-up care within, 7 days, 14 days, whatever is your appropriate window for that. This gives you all the ability to do that. And of course, as we know, that helps drive some quality and financial impact as well. You help avoid readmissions by ensuring the patient gets the right care, gets their medication, is following the right guidance from their discharge planning and discharge summary. You can close gaps in care in a timely manner by knowing that they had this interaction with the local health system. So there's a lot that this can drive and help you make sure that all of your in-house teams that need to be aware of your members' utilization of care are and can help facilitate from there. So Stephen, why don't you take it from here and talk about some of the more advanced use cases where they can start to really use, even more robust versions of the data, both bidirectionally.
Yeah, thanks, Kim. I feel like I'm just going to now start supersizing what Kim's been talking about. In addition to kind of the ADTs, Epic Payer Platform also captures CCDAs and CANDIs or clinical analytical documents from providers. And the challenge here is it's like data-wise, suddenly now it's almost too much of a good thing. That when you combine CCDAs and CANDIs, plans or Epic Payer Platform is in effect capturing often more than 600 discrete data elements plus unstructured data in medical notes. And so I want to give you a sense here. We're up to case number 3 of how InterSystems. Oh, no, go back. On how InterSystems Payer Connector can help. So really focusing on that column on the right. Again, Payer Connector, it's not just retrieving this information. It is from this pile of information, and it really is a pile of information electronically. It's extracting the relevant data elements that your plan system needs. It's transforming them into standards that your back-end systems speak, and then dropping down to the bottom row, and then it is routing the right elements to the right back-end system. So what does this enable? So that documentation that was on the provider side can now be incorporated into your operational processes pretty quickly. And this, in turn, I'm just doubling down on what Kim said, supports a whole slew of different applications. I do want to double click just really quickly here on how it can help with risk adjustment, because this is the next slide, because this has become such a huge area of focus now in light of where the government is heading. As I assume everybody on the line knows, accurate risk adjustment is absolutely essential to ensuring plans have sufficient funds and resources to take care of their members or the provider's patients. And the requirements, at least for how Medicare Advantage plans must do this, continue to become more stringent. So again, in the middle, let me just give you a sense of how Payer Connector can help. And that is, it can actually extract from the encounter information data that meets the authentication requirements for Medicare Advantage and also for RADV audits, and then going to the top right, and then it routes this information to the appropriate risk, coding review, or analytics system. So it really can enable you to do away with a lot of chart chasing, because you already have this clinical data, and now you can mine it before you start chasing all these charts. Let's go on to the next use case. Payer Connector is performing a similar function for an Epic report called Additional Detail Request, or ADRs. Plans can use this report to get additional information that's from the medical record that's often not included in the CCDA, but is relevant to assessing claims. And I now begin to sound like a broken record. What does Payer Connector enable you to do? It enables you to pull out the relative information, transform it into standards that your back-end systems speak, and then route that information to the appropriate back-end system. The next slide just kind of quickly summarizes where we've been. So we're more than halfway, guys. We've done 4 of our 6 use cases. Again, that critical first step, building that foundation, you really do want to automate your ability to pull information out of your member management system so that you're automatically updating within Epic Payer Platform. These are my members, so that Epic Payer Platform can push the right information to you. And then if you kind of move to the next 3, I will acknowledge here, these are all about pulling information from Epic Payer Platform and then pushing it into your back-end systems. But again, what we're so excited about is actually enabling bi-directional data flow here. And that's what the last 2 use cases go to. That ability to actually now go the other way, to reformat the data and the insights from your back-end systems, and then to push it into Epic Payer Platform via the specs that they require so that they can expose it within the provider's workflow. So there's really 2 big use cases that we're focusing on right now with our customers. And the first one, number 5, is closing care gaps. And I mean, the opportunity here is that your quality engine or your care management engine on the plan side, it is often identifying for your members, or if you're a provider, your patients, a number of care gaps that can and need to be closed. And but the problem is, again, that information is sitting over on the plan side. And via InterSystems Payer Connector and Epic Payer Provider, you can now move that over to the point of care, because what we're doing with the Payer Connector is we're aligning that care gap information to the Epic specifications, and then we can securely push it into Epic Payer Platform in a way that Epic Payer Platform can then make it visible within their standard workflows. And if you're used to Epic, what I'm talking about here, they're going to be exposing it in their Our Practice advisories or their health maintenance reminders. I hope the value here was obvious. We know that providers want and are much more likely to be able to close care gaps if they don't get information disassociated from when they're going to see that patient, but they actually see that information, that care gap that needs to be closed at that point in time where they're about to see that patient. Let's do the final use case. I'm going to go switch back to the provider side, right? One of the things we hear from providers, I think I even started out with it, is we want to know more about our patients. We are seeing a complex patient. We know this patient is seeing a number of other specialists. We know that there are societal factors that are influencing this patient's health. And within the EHR, within the Epic EHR, there's this document called the Health Plan Clinical Summary, which is where providers look to learn more about their patients, information that is outside of that immediate encounter. And over on the right, well, what are we doing? Here we go again. Payer Connector, and all that stuff that's under the hood that Kim was talking about is enabling us to grab information from a wide array of different sources and systems on the plan side, structure it, and pull out the relevant stuff that you health plan want embedded in that health plan clinical summary, and put it in a spec that Epic Payer platform can read, and then push it into the clinical summary. You can go down to the bottom to see some of the positive impacts you can have from that. And, specifically, I want to just, obviously that immediate use case where it's supporting that shared understanding of the member/patient and what is the larger context around their condition. It's also enhancing that ability to close gaps. And here I'm not just talking about care gaps. I'm also talking about coding gaps. At the right point in time, we can inform or ask a physician, hey, is this true or not true about the patient? And bigger picture, it is, kind of that really big goal in the sky. It is enabling collaborative care planning between the clinicians on the plan side and the provider side. So I realize we've covered a lot of ground here pretty quickly. I'm going to tap back to Kim to give some closing thoughts.
Thank you, Stephen. So I think we covered 6 amazing use cases there. My job is not done. So as one of the product leads for InterSystems Payer Connector, we are now looking, forward to our next set of use cases, working really closely with our customers who are already, live with InterSystems Payer Connector and Epic Payer platform to figure out where the next valuable use cases come from. And of course, we're always working hard to keep up with the various APIs that are coming out from the Epic team, and working closely to understand and ensure we're providing the best support for those as quickly as we can, regardless of the format, if it's FHIR or whatnot. So let me just summarize by saying, the thing about InterSystems Payer Connector is, in addition to making sure that we are supporting the bi-directional collaboration around quality, performance, and everything else, we're also making sure that we have a unified view. We can help provide that shared awareness across all of your systems. We do our best to streamline everything so that you can leverage InterSystems Payer Connector to drive a lot of your workflows and reduce your manual outreach, increase your reconciliation processes. But essentially, it's about driving that cooperative and collaborative environment within your health plan systems by leveraging the data in Epic Payer platform and getting it into the right place at the right time for your team to work with that data. And again, as Stephen mentioned in the last few use cases, then take that data right all the way back to the provider so they can close those gaps, so they can close that loop, and we'll cycle it back up again. So it's really about really driving and delivering value across that payer provider ecosystem so that you can fully leverage your investment across the technologies.
Yeah, and Kim, I just want to add one thing.
Sure.
It's also about speed.
Absolutely. Getting there faster.
One of the things, that we talked about at the beginning is you can do all this through point-to-point connections.
Yeah.
But if you're in a situation where you do have a significant number of providers who are on Epic EHR and you want to kind of hit the fast forward button to getting to bi-directional connectivity, this can be a powerful tool.
Yeah, that's a great point because it's also, for some of the Epic APIs and formats for some of their workflows here, they even have multiple ways you can do it. Some could be FHIR, but maybe your systems can't do that yet, right? So InterSystems can help support it in a simpler way now. And then maybe you change out one of your systems down the line. You don't need to do any rework with InterSystems Payer Connector or the Epic Payer platform because we can just facilitate then moving to the next application. And so that speed to value as well as having something that as your enterprise changes and grows, it can support you efficiently throughout that as well. So I think we've kind of covered a lot of what we wanted to cover today. Are there any questions out there, Marianne, that we should take?
Yes, thank you, Stephen and Kim, for a wonderful discussion. We do have a few questions, but
Oh,
I do
great.
want to remind our audience that you can continue to submit your questions via the Q&A window in your media player. So here's our first question. And Kim, this one's for you.
Okay.
Do my operational systems need to speak FHIR for all of this to work?
Great question. So I hope I covered that a little bit, but I'll definitely lean into it a bit more. So, in general, the value of InterSystems Payer Connector is regardless of what format your systems speak, InterSystems Payer Connector with our underlying interoperability platform can help transform and facilitate. Supporting whatever that schema and format is, getting the data in there efficiently or pulling it out efficiently, regardless. We speak FHIR, so you don't have to, right? So I know there's also a lot of movement towards FHIR APIs, and a lot of the Epic Payer Platform integrations are FHIR. We certainly speak that and work with that, but we can also move data into your systems in whatever the right format is for that. And as that evolves, we'll keep up with it as well. So great question. Thank you.
Excellent. And Stephen, here's a follow-up question for you. What about providers who are on other EHRs? Can you connect with them?
So I do want to be clear that InterSystems Payer Connector is a companion product specifically built to work with Epic Payer Platform. However, what we're seeing a lot of our early customers do is connect, and this is a connect InterSystems Payer Connector to a clinical data repository, what I would call a true clinical data repository, often uses ours, which is HealthShare, um, and and then take advantage of all those connections that we have with your backend systems. And so what happens is you can connect, once you have that CDR behind it, you can connect information from anywhere. You can connect information from EHRs or whatnot. So in some, like really simply, yes, Payer Connector connects to your CDR, information from other EHRs connects to your CDR, and then that information that in your CDR can be pushed back to all your Epic providers through Payer Connector and Epic Payer Platform.
Fantastic. Okay, here's another question. And Stephen, here's another one for you. What are the pros and cons of connecting with providers on Epic via the payer platform and the payer connector versus directly?
I feel like I've already maybe beat this horse a little hard. Um, so again, I'm going to be straightforward. I mean, you can do this one off. It's kind of where Kim and I wound up. If you are a plan that has a large number of providers within your network who are on Epic, um, this can do two things for you. The pro. One, it can just speed up multi-point connectivity, and it's the other point that Kim made, which is if there's a change somewhere. Instead of having, because you had point to point, actually make that change in each and every one of your connections, you can make that change between Payer Connector and your backend systems, and then it just goes out to everything else. So again, I really think it's speed to value is the big pro. There's no con. It's just going to take a lot longer, and it might require a lot more adjustment if anything changes. If you go point to point, go around Payer Connector.
I would also like to add that the other thing that'll be required if you go down that path is really a robust understanding of all the variety of healthcare standards that are out there, right? And understanding, from HL7 to CDA and there's a lot that is sort of made easy for you through the platform, as opposed to having to learn the depths of some of the various healthcare interoperability standards. So we sort
Oh,
of take.
Kim, I was assuming they were using us to connect one to one.
Oh, okay, all right, yeah, all right, great, yeah, you're
Just
right.
kidding, folks.
Yeah.
Okay, well, Kim, here's another question for you. What data would I be getting beyond what I now get from my HIE or other data vendors?
Oh, that's a good question. So, I've worked in the HIE space and on the provider side for many years, building HIEs. And I think HIEs provide you with a lot of great content. And I know there's other vendors out there that provide sort of ADT services and whatnot. The value of what you get with working with that Prepare platform and that InterSystems connector is first more robust clinical data, right? You get that full CDA, you get it in a timely manner. On the Epic side, it notifies you when there's a new clinical document available for your patients, or sorry, for your members, and then we can pull that in right away and route it to the right systems. So you do get the most robust set of data in that way, and then also the ability to use the ADRs, as Stephen mentioned, to collect even more data. But I think the real power is in the bidirectional element, right? So it's not just about receiving data from an outside source. It's about using and leveraging the data you have within your health system in your workflows, where you identified gaps in cares, where you identified measures that need to be closed, where you've really done the work to identify what you need providers to do to have the best, most complete member care. Then we can take that, route that data back into Epic Payer platform, and therefore get it right back to providers where they can close the loop, where they can update those codes, where they can do the right hierarchical condition code mapping. They can do the work so that you're really facilitating the closed loop on all of that. So that's, I think, the big difference. It's not just about receiving some administrative ADT notifications or receiving some clinical data. It's about how you use that and how you really do the full round trip of leveraging that to work, hand in hand with the provider to get the most robust care done.
Yeah, I wanted to double down on the last point Kim made. First of all, I want to acknowledge there's some variation in terms of how the data arrives from different HIEs.
Yeah,
Um,
that's absolutely true.
so, but for a large number of HIEs, for the people who have not like really gotten up to their elbows in terms of when you say CDA, what are you getting? And you're often getting, like somebody has said, if you actually just printed out all the information you got in the CDA, could be a stack of paper 12 inches high. So it's not just the amount of data you're getting, it's the usability of that data. And so one of the things that you do get with Payer Connectors, again, that ability to reach into that kind of, I don't want just large chunk of information and not and pull out the relevant fields or data elements that you health plan want to push into your backend systems.
Fantastic. And Kim, here's another question for you. Is this available as a managed service or on-prem?
Oh, good question. Yeah, I know a lot of organizations now are looking more to leverage, cloud and managed service-based offerings. So we provide it as both. So InterSystems Payer Connector can be deployed on-premise. So if you or in your own public cloud, if you choose. Otherwise, we do have a cloud version where you can, sign up for our service and we'll deploy it in our cloud for you with all the security and, of course, give you access for various integrations. We also provide a RightStar package that can be where you can leverage our professional service team to get your first few use cases done. And we have a pretty competitive little RightStar package for that. And that's available both for if you're going to do it on-prem or in your own public cloud, or if you want to use our cloud hosted offering.
Great to have that flexibility. Looks like we have time for one more question. How does your solution work with an existing data warehouse? Stephen, you want to start us off on that?
Yeah, I'm going to try to clean up maybe my last response around CDRs. Uh, we actually think it's great if you have a data warehouse, because that means that we can connect with your data warehouse and all the information that we're ingesting from Epic Payer platform, we can flow into your data warehouse, so then we can expose it for multiple systems. And then vice versa, in terms of all that information is in the warehouse and we can leverage all of it to pull out the relevant pieces to flow back into Epic Payer platform. Not only are we fans of connecting to a warehouse, we're actually fans of connecting to what I would call a true CDR. A place where there's actually some normalization of the data going on within that repository, because otherwise you're going to have to do a lot of one-off transformations between that data sitting in the CDR and all your backend systems. So you can really just supercharge the flow of data if you've got a true CDR back there that does all the deduplication, all the normalization, all the harmonization, because then we can go from InterSystems Payer Connector, we can put it into that environment, and then all your backend systems can avail themselves of whatever the relevant elements are needed without heavy-handed coding to enable them to dip into what sometimes is a variable data warehouse.
Kim, anything to
Kim,
add
you
on
want to
that?
add?
I don't know how much more I can add. I think you covered it well there. I guess what I would say is we can work with an assistant data warehouse, and we do. So even in our existing customers for InterSystems Payer Connector, I know there are data warehouses in use. And as Stephen mentioned, we both leverage those to retrieve data from the data warehouse in the format they need and package it up in the right way to send it into Epic Payer platform, particularly for health plan clinical summary or for some of the gap in care use cases. The other thing, of course, we do is we take that rich clinical data CDA. I haven't run into a data warehouse yet that speaks CDA. So we take it, we put it in the right format, and we get it in there. And that means that data warehouse then has real-time clinical data. So it's not delayed. It's not from last month, but it's real-time enriched clinical data to really help you leverage that in the best way. So we're happy to work with data warehouses, and we do so pretty efficiently because of those same interoperability capabilities that we talked about earlier in the not podcast, earlier in the webinar.
Fantastic. Well, at this time, we do have to wrap up. And Stephen, Kim, thanks again for all of your insights.
Thank you so much, Marianne. It was so great to chat to you for the last little while.
And thanks to everybody for sticking with us.
Yeah, absolutely. Right.
And once again, we do want to thank our sponsor, InterSystems, for their support of this webinar. For our audience, don't forget to take our brief evaluation at the end of today's event and share your thoughts with us. As a reminder, you'll receive an email within 24 hours to rewatch the on-demand recording of today's session, and it'll be available in the HIMSS Resource Hub for a limited time. So feel free to come back and watch it anytime. Thanks, everyone, and have a terrific rest of your day.